Hello and welcome to Fix Your Smile. First dentist visit coming up? Or maybe it's just been a while. It's completely normal to feel a little anxious or unsure about what's going to happen. The sounds, the tools, the unknown, it can be a lot. But here's the good news. Modern dentistry is all about your comfort and safety. And the best way to conquer that uncertainty is with information. So, let's walk through it together, step by step, so you can go into your appointment feeling confident and in control. Step 1. Check-in and paperwork. Your visit starts at the front desk. Plan to arrive about 10 to 15 minutes early, as you'll need to fill out a health history form. This is a crucial step. You'll be asked about any medications you're taking, even over-the-counter ones, any allergies you have, like to latex or certain metals, and any past medical procedures or conditions. Being thorough here is incredibly important, as it helps your dental team understand your overall health and tailor your care to keep you completely safe. You'll also need to bring your ID and your dental insurance card if you have one. This allows the office to process your benefits smoothly. Step 2. Meet the team. Once you're called back, you'll likely meet your dental hygienist first. They are highly trained professionals who will be your guide for most of the visit. A great hygienist will always explain what they're about to do before they do it, making sure you're comfortable every step of the way. This is the perfect time to voice any concerns. If you're nervous, just say it. They've heard it all before and are there to help. You can establish a simple stop signal, like raising your hand, which puts you in complete control. If you need a break for any reason, just give the signal. Step 3. X-rays. For a first visit, your dentist will likely want a set of X-rays. These are essential because they allow the team to see what's happening below the surface. Things like cavities between teeth, the health of your jawbone, and the position of your tooth roots. For these, small, smooth plastic sensors will be placed inside your mouth. You'll be asked to bite down gently on a little tab to hold the sensor in place. The machine will make a quick click or beep, and that's it. The whole process is very fast. And don't worry about radiation. Modern digital X-rays use an incredibly low dose, and you'll always be covered with a lead apron for extra protection. It's vital to tell your hygienist if you are pregnant or think you might be, as they will typically avoid X-rays or use alternative methods. Step 4. The cleaning. This is where your teeth get a deep clean. The hygienist will remove plaque, that soft, sticky film of bacteria, and tartar, which is hardened plaque that you can't remove with a toothbrush at home. They might use a small hand tool called a scaler to gently scrape it away. Many offices also use an ultrasonic tool. This instrument vibrates at a high frequency and sprays a gentle stream of water to break up and wash away tartar. You'll hear a humming sound and feel the water, but a small suction tube will remove the excess from your mouth. A professional cleaning should not be painful. However, if your gums are inflamed or your teeth are sensitive, you might feel some discomfort. Don't hesitate to speak up. You can ask for a topical numbing gel, or simply ask them to go slower and take more breaks. And remember, you can always bring headphones to listen to music or a podcast to help you relax. Step 5. Polishing and flossing. After the scaling, it's time for the polish. The hygienist uses a slow-speed rotary brush with a soft rubber cup and a special gritty toothpaste called Prophy paste. This removes any remaining surface stains and leaves your teeth feeling incredibly smooth and clean. That classic just left the dentist feeling. The final touch is a professional flossing. This not only cleans between your teeth, but also allows the hygienist to check the tightness of the contacts and the health of your gums. Step 6. The dentist's exam. Now the dentist comes in for the final check. They will visually inspect each of your teeth, looking for signs of decay or wear. They'll also check your gums, sometimes using a small probe to measure the depth of the pockets between your teeth and gums. This is a key indicator of gum health. Then, they'll review your X-rays with you, pointing out any areas of concern like potential cavities, the condition of existing fillings, and your overall bone health. They'll also check your bite to ensure everything is aligned properly. If any treatment is needed, this is when they'll discuss it. They will explain your options, the estimated costs, and the ideal timing for any procedures. Remember, this is a conversation. There should be no pressure and absolutely no surprise procedures. You are in charge of your healthcare decisions. Finally, you might be offered an optional fluoride treatment. This is usually a varnish that's quickly painted onto your teeth. It's a concentrated dose of fluoride that helps strengthen your enamel and fight off cavities. It often has a pleasant taste, sets in just a few seconds, and you're done. If you get it, you'll likely be asked to avoid eating or drinking for about 30 minutes to let it fully absorb. And that's the wrap-up. Before you leave, you'll head back to the front desk to handle any payments and schedule your next appointment, which is typically in 6 months. You'll also get a little goodie bag with a new toothbrush, floss, and maybe some toothpaste. Most routine checkups and cleanings take about 45 to 60 minutes. You'll walk out with a fresher, healthier mouth, and most importantly, with the mystery and fear gone. You've got this. Taking care of your oral health is a huge part of taking care of your overall health. The first step is often the hardest, and you just mapped it all out. Thanks for watching. Don't forget to smile, share, and subscribe.